Welcome to the Phoenix Prosperity Podcast, where wealth meets legacy. Join your host, Tim Fergestad, as we explore the journeys of Phoenix's finest to success and beyond.
All right. Hello, this is Tim Fergestad. Thank you for joining us. Today's guest is Dr. Nathan Delafield at the Mayo Clinic, a physician researcher whose work targets the social determinants of health, the factors that drive up to 80% of disease. He focuses on health equity, reducing disparities, and engaging communities to improve outcomes. Welcome to the show, Dr. Delafield.
Thank you for having me, Tim.
This is a fascinating topic. This is something that I've appreciated more and more in our current society and culture, right? When everybody fast-acting carbs and sugars and all the environments that people are in. I've had somebody else on the show. I'll see if I can remember it later on. Who's doing something similar. He's doing it in a more nonprofit sort of way.
Yeah.
But big impact. I mean, in light of some of the studies, I think it was a while ago now, but like the blue zones work, just showing how important different cultural norms are and the different factors in an environment that can determine health and future stuff. Let's start. Can you talk a little bit first about how you got into that field? What made you choose to specialize there?
Yeah, so I'm an internal medicine physician, and
Okay.
I have become really interested in the social factors that influence health outcomes, largely because of both my personal upbringing. I grew up born and raised in Phoenix, actually raised in foster care
Oh,
throughout
wow.
my entire childhood. And I became aware as a child and growing up of the environmental factors that influence one's trajectory, one's health outcomes, one's life experience. Later
Yeah.
on in my training, I returned after completing my residency at Mayo Clinic. I returned to work in a federally qualified health center environment in a very urban, underserved community, and I saw every day how my patients were suffering from health disparities, and it was largely related to the environment that they were living in and their ability to access healthy food, to
Right.
maintain a living wage and all of those influences on their health outcomes. And so it has been my career's, mission to better understand these factors and importantly to develop some tools and resources to help my patients through them.
Okay. Yeah, that's it was Tomas Leon was I had on here. He's the president of Equality Health Foundation. Are you familiar
Yes.
with him? Okay.
Yes. Tomas and I have interacted several times, and he leads Quality Health. And it's an important point that you mentioned that a lot of the work being done and a lot of my interest in social determinants of health actually relates to the nonprofit sector,
Okay.
because these are the content experts that are doing the work that are most familiar with the communities that are affected, and so a lot of our paths have crossed in that way.
Okay. Okay. Interesting. Cost, for example, is one thing. Eating fresh organic food is not cheap.
Correct.
And, price per calorie, right? I think you're better off with bad, salty ramen, right? You can get some pretty good calories for pretty cheap at the store with the processed stuff, which is kind of unfortunately the default for a lot of people, right?
Correct. Yeah,
So, so,
your zip code is probably more indicative of your health outcomes than your genetic code. And so it's
wow.
really important that we think about food deserts, accessible and affordable foods, the ability to live in an environment that's safe, to achieve an education, and all of those factors that have compounding influence on health outcomes over time.
Right, right. That's a great point. I think health equity group, zipcodeexam.com, right? That was
Yeah,
something that I don't remember if that was what Tomas and his group created. Is that right?
I'm not sure.
Okay. Anyway, but yeah, that's a crazy thought to me that environment's way more, nurture over nature
Correct.
impact. Um, okay, so what are the challenges in trying to change or educate people and change those sort of habits? Because those cultural, right? Those they don't just you can't just tell them, oh, that's bad for you because it's their identity, right? They don't want to give it up.
Well, I don't think
Like
that
Christmas cookies right now for me. I know it's bad for me, but it's part of the culture.
Yeah, I don't even know if it is as much cultural or as it is societal, right? The
Okay.
societal factors that influence default decision making. So, certain individuals are more likely to eat unhealthy food not out of necessarily choice, but because of need, right? We recognize that healthy food is expensive or it's
Hmm.
inaccessible. I live in a food desert, for instance. If I were to live in a food desert, then it may be inconvenient and difficult for me to
Sure.
even access. There may be education related issues, not understanding that that the processed food is not healthy for you. And so I don't think that it is as much cultural, though there are some factors that are there
Okay.
as it is societal. And so as a society, we need to think differently about how all individuals are given an equal opportunity toward a healthy lifestyle. And that
Okay.
includes making sure that food is affordable and accessible, that education is attainable, that living wage is reasonable, and that our environment is safe, that healthcare is accessible. And so there's a that's it's a much bigger problem than one individual, family, community, or culture.
Okay. Okay. Yeah, good points. And I guess the free market has dictated what's available out there, right? People have voted with their dollars for decades, right? And so it's not, I don't think it's necessarily a grand evil conspiracy. There are some, right? The food pyramid's upside down and all that sort of stuff. But and maybe, Monsanto and chemicals in some of our food is also another issue. But um, people are being educated and they're creating a demand for organic, for example, that's becoming more available and the price is coming down as people vote with their dollars. Um, what has to happen? What are some of the challenges right now you think that are at the forefront?
Well, I think we need to continue highlighting that the health outcomes for our community members are being driven by these social factors. And I think we all need to realize that this is not a they problem, but this is an us problem as well. If we cannot begin to address the factors that influence negative health outcomes and negative health disparities for communities that don't look like us, then we are likely down the line to suffer the same poor outcomes eventually in our own communities. And so we have to begin to prioritize this for others and realize that affordable housing, that affordable and accessible healthy food, that education is a right for every person to take advantage of, and we should really provide a community, an environment in which everyone can be successful in their own right. And not to say that we're providing a handout or anything like that, but to ensure that these policies, because I think that it's really a policy level decision, policies are being made in order to support the public health and not only certain communities that can afford it.
Okay, okay. Um, in a free society, right? We have if you make vegetables cheaper than Doritos, the, people often still choose the Doritos, right? What I think education is even if it all things being equal, right? If you can create healthy food options that are even affordable, I think people still sort of have a struggle choosing the that is. Do you know what I'm saying? What's sort of the best way forward in that regard?
Well, I think education is one part of it. I think marketing is another also. I think, you see uh, processed food commercials often. You rarely see tomato commercials. You may see avocado commercials or almond commercials, but I think
Right.
marketing and education are really important, particular to our youth and the impact and influence that may have. But I also think as a society, one public health strategy that's very effective is making the default decision the healthy decision. So a good example of that is you don't choose whether or not you have iodine in your salt. It's included in your salt for the most part, and that choice has been made from a public health perspective to eliminate and mitigate disease. Similarly, we you don't choose where you place your crosswalks. The default decision is that crosswalks go where traffic ends, and so these default decisions are actually public health strategies. What we
Okay.
should push for is that the default decisions are the healthy options that improve and that perpetuate positive, healthy choices. Um, we also have to push education, marketing, ensure policies that support these decisions, and ultimately, I think that those are strategies that will lend themselves to folks making better choices.
Okay. Okay. I've been focusing and asking you about food, but there are other, social determinants of health, right? And besides food, which I think is a big one, what are some of the other factors?
Yeah, and I've mentioned several of them. Education, access, affordability, and quality is really, really important. We know that early childhood education is critically important to even adult outcomes.
Right.
We know that housing, we're living in a substantial housing crisis right now, and the unhoused are more likely to suffer from chronic disease and acute
Sure.
disease and trauma and illness. And so housing is a huge one. Um, the social context in which we are living, where there is often, um, you know, uh, challenge as it relates to individual political views. That also, as a mechanism of driving up stress in the community and fragments community members, is another social determinant of health that can influence health outcomes in ways that we've often not thought about. And so there is a very good construct in the ways in which we think about SDOH, and that is a SDOH, or social determinants of health wheel. And this includes items like we've talked about: education, food, employment, the economic influence, the neighborhood and built environment. Do you live in a food desert, or do you live in an area with green spaces and healthy food markets? So all of these factors really, really meaningfully influence our health outcomes. And
Right.
depending on your cultural context, they may even be different. So, for instance, there is a Native American wheel for the social determinants of health that includes the land, the sky, the water, um, nature, animals, that are culturally very appropriate and informative to the health outcomes of the Native American community. Similarly, there are wheels that have been translated into different languages. And so we also have to consider the multicultural nature of these impacts as
Huh.
well.
Okay. Interesting. Um, we haven't talked about movement or exercise much yet. Speaking of a food desert, we're also, I mean, part of the year is pretty hot. It's pretty hard to go outside and get activity and so forth. It's just kind of
Correct.
restrictive. And we don't have some areas of town, for example, don't have nice big parks and community centers and stuff. So I imagine I like the idea of the wheel. I think that's good because yeah, it's multifactorial and although the what were some of the bigger determinants of health span in like the blue zone studies, for example? It was not just movement and food, but wasn't it like social?
Yeah, social interaction and community support.
Okay.
The absence of toxins, right? So
All
alcohol,
right.
tobacco, and other environmental factors that can impact health outcomes, increasing risk of chronic disease, metabolic syndrome, and cancer. So all of those factors play a big role. Exercise is very important, but to your point, is exercise equally available to everyone? One can say, yeah, it's easy. You can go outside and exercise. Number one, do you know what to do? Number two,
Right.
do you have a safe environment to exercise in, or a park, or a community center? Can you afford to go to a gym or to pay a trainer? Can you afford the nutritional guidelines that are being recommended to you by experts in the field? So it's
Right.
it's much more nuanced than that. And I think we take for granted our privilege in being able to go to the gym or have multiple memberships or go outside and walk in our neighborhoods.
Okay. Great points. Great for sure. For sure. And what sort of engagement are you doing with communities to try and improve outcomes?
Yeah, a few different ways in which I have been engaged with the community. Number one, I'll say through my church. I belong to First Institutional Baptist Church, now Pilgrim Rest Baptist Church in Phoenix, and involved in the medical ministry to support our
Okay.
congregation in ensuring that education is being provided, that support is being provided, that health screening is being provided. A second way. that I've been engaged is through my work as a physician. And so in caring for my community, I'm a community internal medicine physician. And so patients are often, referred to me for their primary care needs, and I take great privilege in being able to support them in their health journey. A third way is through research. I have been involved in research studies that have engaged nonprofits, locally, federally qualified health centers, and communities that suffer from significant health disparities. We recently published an article in the Journal of the Joint Commission that recognized that by providing enhanced social support to patients who had significant social determinants of health barriers, we were able to actually improve their health outcomes. We were able to reduce the burden of those SDOH challenges that ultimately provide an opportunity for them to get healthy again. And then last, through advocacy and leadership, I serve on the executive board and the board of trustees for the Vitalist Health Foundation here, and one of the largest public health foundations in the state of Arizona, really advocating not only for our public health policies, but also for the support of the nonprofit sector and the work that they do to support our communities in Arizona to provide the healthiest Arizona that we can possibly have.
Sure. Okay. Wow, that's a lot. Great stuff. Thank you. So what's your research focus these days? I mean,
My research,
yes,
yeah,
obviously it's social determinants of health, but I mean, you focusing on in particular factors.
yeah, a few factors that I'm most interested in include access to healthcare in a timely fashion, in particular for communities that have been historically those that suffer from healthcare disparities.
Okay.
Uh, and number two is developing really novel or new solutions to long-standing social determinants of health-related barriers. So again, I'll highlight in our recent article published in the Journal of the Joint Commission, we showed that providing social capital, a community of support from volunteers was possible, was a mechanism by which we were able to reduce the burden of social determinants of health for patients receiving their care in a federally qualified health center environment. And last, it's through really thinking about how do we better understand the factors that influence outcomes for a variety of diseases. We're currently completing a research study looking at valley fever. Historically, valley fever has been well known to influence certain communities worse than other communities. For instance, the data has long stated that if you're Black or African American or of Filipino descent, that you're more likely to have disseminated disease or even potentially die from your disease related to valley fever, which is often a self-limited disease. However, we've never really understood why. There's been lots of theories as to why. Maybe the immune
Okay.
system is different, but we now know is that our immune system is far more alike than it is different. The Human
Okay.
Genome Project proved that. And so now we're shining a light on the social factors that are more likely influencing the healthcare outcomes for this disease and so many others to better understand them so we can build solutions around them.
Okay. Yeah. And can you talk more about the factors that drive up to 80% of the disease, right? Yeah. I think that I mentioned that in the intro for a lot of our listeners. I think that's a surprising statistic.
Yeah, so we've traditionally thought that biology was the reason that disease was present or made worse, why outcomes for certain individuals were worse than others. But now we know that again, we're 99.7% alike biologically, so that's not likely the difference in disease outcomes. But if we compare two people with equal biology, one person has easy access to healthcare, to nutritious food, to affordable housing, they have a good job with health insurance, they're safe in their environment, they're going to do substantially better than the other individual who really struggles to access healthcare. They can't afford the medications that are being prescribed, that can't take advantage of the preventative healthcare services that are being recommended. And so as a result, we recognize that these are the drivers of healthcare outcomes. We have population health statistics that help us to understand that at a population health level, those that are in environments of vulnerability do a lot worse. And so when we look at these factors, we know that they're contributing to 50 to up to 80% of healthcare outcomes. And that's something that we can't ignore, because
Right.
what we are doing is we're developing really novel and interesting therapeutics for small fragments of disease outcomes. We need to really look at the big picture.
Right. Right. And to your point, the environmental stuff has the biggest impact, right? It's a huge burden on our healthcare system right now that could be, I don't know, I'm sure it's worth trillions. Um, you reminded me, I'm thinking of like twin studies and stuff. As a geneticist, that's some of the best controls you can have, and when you can have somebody in one environment over another. And I have a friend. This is just a side joke. Who he has an identical twin, and they live different lives. And my friend doesn't go to to his doctor's office very often. He just asks his brother how we're doing
That's
periodically.
hilarious.
That's his joke. Yeah, how are we
That's
doing?
great.
Yeah, I anyway. Uh, so I guess I wanted to ask you a little bit more about the challenges, but maybe some of the misconceptions that you run into when people talk about social determinants of health.
Well, I think one misconception is that this is all by choice, and I think that choice um, is likely less relevant. It's more likely that there are societal factors that are contributing to default decision making. And so we have to really understand that these choices that are being made are often of survival, and having accessible food is a privilege. And so there are really some bigger issues that we need to begin addressing. And it's not always just pull yourself up by your bootstraps and make a better choice. It's really, how do we support individuals and communities to ensure that they are able to make the right choices, and that they are provided the same opportunities. That's what equity is all about, right? Having the equal opportunity to achieve a similar outcome. It isn't
Right.
necessarily anything else. And so I think that's very important. I think it's also very important to recognize that despite our large body of data that
Mhm.
emphasizes that we are so similar biologically, we continue to point toward biology as it relates to these disparate outcomes, and we really need to think about environment more.
Sure, sure. Um, and yeah, we already mentioned it, but yeah, the cost of bad food is often much cheaper than healthier food. Although I would point out that like McDonald's, right? They got a lot of grief for a long time for having really bad food. So they went ahead and they implemented salads and all this other stuff, and nobody bought them. So
Well,
it's
and interestingly, the cost of most fast food, including McDonald's, is no longer super cheap. And so,
oh right,
we have and this is a Western society thing, particularly in our Western society, we have a fairly unhealthy diet with processed foods, non-whole
hmm
foods, and these factors are contributing to chronic illness. And so,
for sure.
whether it be in communities that suffer disparities or not, we have to address these factors because they are contributing to the unhealthy lifestyles of our community members.
For sure, for sure. So what is the biggest challenge in the field, in your opinion, right now to get that sort of change?
I think we still need there are a few challenges. I think that that the idea of SDOH has is unfortunately at times, as it relates to social determinants of health, at times become politicized, and I don't think it's a political conversation. I think number two, from a research perspective, as we begin to really delve deeply into the nature of the individual impact of these factors, leveraging data is hard, and leveraging data on an entire wheel of potentially influential um, uh, items that make up the SDOH is
Right,
really difficult. And none of these factors, housing, environment, food, um, uh, economic standards, none of these are influencing health outcomes in a silo. So one of the
right,
challenges that we have from a research perspective is to understand how they interact with human biology and influence health outcomes differentially, uh, collaboratively, and begin to really implement strategies that begin to really solve them. So I would say the biggest opportunity is finding solutions. we've described the problem for long enough. We need to develop solutions now that support communities all around the world who are suffering from healthcare outcomes that are less than optimal.
Right. Are there other countries that are making better headway on this?
Well, I'll say that there are many countries that are making headway. You know, the United States has one of the worst health outcomes in all of the developed nations, and we spend highest amount of money. And so the answer isn't throwing more money at it. It's coming up with more solutions that support the public health, that are supportive of all individuals, regardless of their financial standing and education, and creating a mechanism again where the default decision is the healthy one.
Right. Right. It's a big challenge, and it's yeah, health is arguably the biggest factor affecting everyone's life, right? In the US. It's massive. Thank you very much for devoting your focus on it.
Yeah,
Uh,
absolutely.
um uh so Nathan, reflecting back, as we wrap things up, I have a couple questions I like to ask the guests sometimes. Reflecting back, what do you wish you would have known sooner about building success in your career?
Yeah, that it's a marathon, not a sprint. I think that there's a conception as an early, very aspirational and energetic professional that you will reach success quickly, or that you have an idea what that will look like, and having the realization that will take time. But each step along the way is valuable to building what will ultimately result in a very successful career that is that one that I can be proud of.
Okay, yeah, it's not you didn't take the overnight success path, that's for sure. Most people don't. They think it's there, right? That's the social media illusion, I think. To
Yeah,
be
absolutely.
discovered and be an influencer and be right on some show. Um, okay, and have you done anything like in 2025 or recently that's changed your life?
Yeah, I have taken lots of domestic and international trips with my family, spent time with my
Okay.
young children, and devoted just some core memories to family and to those that I love the most, and been unapologetic about it.
Nice. Any particularly meaningful trips lately?
Recently returned from Grand Cayman, and a few months ago from Mexico City. Very memorable, great times, great opportunities to connect with the family and spend time
Right.
abroad. Learn. One of those trips was in Cayman was for medical education. I really
Oh,
just take an opportunity to take it all in and to become my best self around those that I love the most.
right. Awesome. Awesome. Um, I'm waiting right now. I have an opportunity to go to Kilimanjaro next year. It's so tempting. I really want to do it. I just don't know if I can swing it with the schedule.
Yeah,
I've been to Cayman. Did you take the kids out in the out in I don't remember what they call
Stingray Bay.
Stingray City and all that, but
Yeah.
at night for the bioluminescent stuff like
No,
kayaking at night. Oh, okay,
the kids aren't really into much of that. We got stung by plenty jellyfish
jellies.
on
Oh no.
on the beach, but it was a good time. I
Okay,
took the kids out on the kayak, just went out
okay.
to the reefs and came back during the day though.
Okay. Okay. Excellent. Excellent. Yeah, it's beautiful there. Did you rent a car? I did that there. We had to get around that.
No, I can't imagine. I've been there a couple of times, and driving on the left side of the road
Yeah.
is terrifying. So I just got a taxi everywhere I went.
Yeah, it's a trip. It's a trip. Okay, cool. That's a fun place. Beautiful.
Yeah,
All right.
absolutely.
All right. Very nice. All right. Well, Dr. Delafield, if people would like to connect with you and learn more, where can they go? What should they do?
We can connect with me on LinkedIn. Certainly available there. I'm here at Mayo Clinic in Arizona. Happy to be a resource, whether it be through collaboration or another initiative. And that's how they can get a hold of me.
Okay, excellent. All right. Well, thank you, everybody, for listening and watching. Thank you very much, Dr. Delafield, for joining me today and sharing your insights into such a huge, epic issue. Thank you.
Thanks, Tim.
Inspired by our guests? Visit phoenixprosperitypodcast.com/guest and join us on the show and share your success story with Tim. The spotlight awaits.